In this lecture, we are going to talk about antihistaminic drugs, specifically the drugs which are blocker of the H1 receptors. The H2 receptor antagonist are a different class of drugs which are discussed in the category of gastrointestinal drugs, and they are used as antacids. But we are not going to discuss this class of drug. We are only focused on H1 receptor antagonists. So how are H1 antagonists classified? The H1 antagonists are classified into two categories. The first generation antihistaminic and the second generation antihistaminics. The first generation antihistaminics are divided into three categories: highly sedative, moderately sedative, and mildly sedative. The highly sedative drugs carry a lot of side effects related to CNS depression, and they include drugs like diphenhydramine, dimenhydrinate, promethazine, and hydroxyzine. Moderately sedative drugs include phenyramine, cyproheptadine, meclozine, and cinnarizine. And if you remember from previous lecture, we had discussed that cyproheptadine is also used to treat anorexia in children because of its ability to increase appetite. By blocking the CNS stimulant effect of histamine, CNS stimulant histamine effect. The mildly sedative drugs include chlorpheniramine, dexchlorpheniramine, triploridine, and clemastine. And you will find a lot of cough and cold preparation. They contain a mixture of some mildly and some moderately and sometimes highly sedative drugs. The second generation antihistaminics are also known as non-sedating antihistamines, though this is a misnomer because these drugs, because of pharmacogenetic variations, still tend to produce mild to moderate sedation in a significant population while remaining non-sedating to rest of the people. They include common drugs like cetrazine, levocetrazine, loratadine, fexofenadine, desloratadine, azilastine, mesolastine, and ibastine, etc. You will find that this class of drug and this class of drug and this class of drug, while all being antihistaminic, anti-allergic, find different uses. The antihistaminics, the first generation antihistaminics, can also be classified based on their chemical nature, and they include drugs like the categories like ethanolamines, which will include diphenhydramine, or drugs like alkylamine category, that can include drugs like chlorpheniramine, and so on. A chemical classification is given in the PDF attached in this video. So what is the mechanism of action of antihistaminic drugs? Antihistaminic drugs act by blocking the H1 receptor. When histamine binds to H1 receptor, right, it produces effects like increased gastric secretion. It leads to increased vasodilation. It leads to increased CNS stimulation. It leads to increased activation of sensory nerve endings. That leads to pain and itching. Vasodilation leads to increased redness and also pruritus. And CNS stimulation leads to wakefulness. as well as decreased appetite. In addition, this can also lead to bronchoconstriction and contribute to anaphylactic reaction. H1 blockers, the drugs which belong to this class, generally are either competitive antagonists or they are inverse agonists. Important to note is that majority of the drugs are inverse agonists. A significant number of drugs are inverse agonists and a few drugs are competitive antagonists. What is the difference between competitive antagonism and inverse agonist? Competitive antagonists, they compete with the histamine for the receptor site, and the one with the higher quantity will prevail and will produce its effects. If the competitive antagonists are higher in concentration, they will bind here. And as you know, antagonist means they have positive affinity for the receptor, means the competitive antagonist will bind to H1 receptor but zero intrinsic activity. That means it will produce no effect. So what it does is that it negates the opportunity that histamine could have got to activate this receptor. On the contrary, if you look at the inverse agonist, you will find that an inverse agonist produces opposite effect. So all autocoids have a baseline level in your body that increases with allergy, inflammation, or any traumatic condition. When you take an antagonist, it will bring it back to the baseline level. But when you take an inverse agonist, you will find that even the baseline activity is reduced. So inverse agonists tend to reduce the basal activity of the intrinsic or indigenous histamine that is present in your body as well, thereby contributing to more potent antihistaminic effect. So when they block the histamine receptors, what all actions are blocked? Number one, vasodilation is blocked. So H1 blocker will prevent vasodilation, thereby reducing redness or reducing. They also block the vascular permeability that is induced as a result of vasodilation in the capillaries that was leading to fluid exudation. This contributes to swelling and urticaria, and all these effects are blocked by the antihistaminic drugs. The third effect of histamine that is blocked by antihistaminic is bronchoconstriction. And as they block the bronchoconstriction, they prevent the bronchospasm or they lead to bronchodilation. And lastly, they prevent the sensory nerve stimulation. As the sensory nerve stimulation is prevented, it leads to reduced itching, sneezing, and reduced pain. Let's compare the properties of the first generation and second generation antihistaminic, as this is a very common question asked in undergraduate level examinations. The first property that is to be compared is the receptor selectivity. You will find that second generation antihistaminics, which are the non-sedating type, are highly selective for H1 receptor. Whereas if you look at the first generation, that is sedating type, in addition to blocking H1 receptor, they also act on muscarinic type 1 receptor, alpha receptors, 5-HT receptors, and when you study the specific drugs, you'll find that other drugs also have some other receptors on which they act. It is mainly anti-muscarinic effect and blockage of H1 receptor in the CNS that is reported to contribute to CNS depressant effect of antihistamines. All first generation antihistaminics cross blood brain barrier, and that is why this effect is produced. Whereas the second generation antihistamines have minimal or no crossing of the blood brain barrier. As a result, they became non sedating type. Sedation is common, and therefore sedation is either minimal or none. Anticholinergic side effects are common, whereas in second generation the antihistaminic cholinergic side effects are either minimal or none. Example of drugs you have already seen. What are the uses of antihistamines? So antihistamines are primarily used to treat allergic rhinitis, allergic conjunctivitis and urticaria because they block the H1 receptor on the vascular endothelium and decrease the vasodilation associated with the all the inflammatory conditions like rhinitis and conjunctivitis. They also reduce the vascular permeability and thereby decrease the swelling, edema, or fluid exudation commonly seen and a common cause of running nose, for example, in allergic conditions. They also reduce itching and pain by decreasing the sensory nerve stimulation in the periphery of the body, specifically on the cutaneous surface, and thereby they also reduce the edema, as we have already seen. Secondly, antihistaminic drugs find an adjunct role in the treatment of anaphylactic reactions. How do they find an adjunct role in the anaphylactic reaction? You all know what happens in the anaphylactic reaction. That's a severe allergic reaction in which a person can go into anaphylactic shock. So the primary treatment is epinephrine, and it is sometimes clubbed with steroids. But antihistamines have an adjunct role. So when you give antihistamines, they lead to less flushing, less urticaria, less residual vasodilation, and thereby act as an adjunct, while epinephrine remains the life-saving therapy. Atopic dermatitis and insect bite reaction, they are associated with, when an insect bites, there's a lot of itching and urticaria or pruritus, and antihistamine reduce that itching and inflammation by the same mechanism as we have discussed. The first generation drugs, which tend to have M1 blocker effect, can also block the cholinergic receptors and in the CNS, specifically in the vomiting center, and can be used in the treatment of vestibular disorders. Vestibular disorders are the disorder associated with the balance of the body and in the vestibule in your inner ear, that leads to nausea. A lot of nausea develops in the patient. Same thing happens in the motion sickness. It can be car sickness, it can be sea sickness when you're traveling on a ship or on a boat, where there is a lot of mobility and the vestibular region is constantly being stimulated, that activates your vomiting center. And by blocking the M1 receptors in addition to H1 receptors through their CNS penetration, these drugs lead to reduced nausea and vomiting, and they improve comfort during the travel or during the vestibular disorders. Similarly, they are also can be used, were or previously used in nausea and vomiting associated with pregnancy, because they will act on the afferent input of the GI tract and the vestibular system, and via H1 and M1 receptor blockade, these drugs will decrease the nausea. Because the first generation antihistaminics have the CNS depressant or sedative effect. They were used in the treatment of insomnia, though now we do not use it for this use as well as for this use because we have better alternatives. And again, common cold symptoms, which are mainly inflammatory symptoms associated with your respiratory tract and nasal mucosa. The antihistaminics decrease histamine mediated nasal mucosal irritation as well as decrease the running nose symptoms. The first generation antihistaminic carry the side effects which are known as anticholinergic side effects, and therefore because of this they produce a useful effect, that is anti-secretory effect. And lastly, they are used in the treatment of anaphylactic reaction, as we have seen with the anaphylaxis, by reducing pruritus, erythema, and edema caused by histamine release from the mast cells. What are the common adverse drug reactions associated with the antihistaminic drugs? The first and the most common reaction is the sedation, and sedation is mainly caused by the lipophilic drugs which cross the blood brain barrier and block the histamine pathway in CNS and produce M1 blockage. Right? This anticholinergic effects are produced not only by the M1 blockage but because of non-selective blockage of muscarinic receptors. The drugs which also produce alpha blocker effect tend to produce vasodilation that can lead to orthostatic hypotension. Many drugs tend to block cardiac ion channels, and thereby they tend to produce arrhythmia, specifically the potassium channel blockers, arrhythmia. Drugs like terfenadine and estimazole have been banned because of their cardiotoxicity. Some drugs they tend to produce idiosyncratic reaction in your CNS and thereby tend to increase CNS activity instead of causing sedation, and this effect is more common in children. And lastly, some drug components which are used in topical and parenteral preparations can generate allergic reactions as well. If we compare all the pharmacokinetic properties of various antihistamine, you will find that both second generation and first generations are well absorbed orally. If you look at metabolism, you will find that the first generation undergo extensive hepatic metabolism, whereas the second generation have minimal hepatic metabolism and they are not a very common substrate for cytochrome P450 enzyme. First generation cross blood brain barrier and produce CNS side effect, whereas this is not seen with the second generation. Both are excreted in urine, but first generation are generally excreted as metabolites, whereas the second generation, many of them are excreted unchanged. First generation tend to have a shorter half-life, whereas the long generation tend to have a longer half-life. The result of the shorter half-life is that they have a short duration of action. Therefore, if you are using a cough medication containing first generation drugs like chlorpheniramine or diphenhydramine, you will require multiple daily doses. Whereas the second generation are long duration products and they only require once daily dosing in most cases. For example, cetirizine tablet is taken at a dose of 10 mg once a day. The bioavailability of first generation is variable and is often reduced by the first pass metabolism, whereas the bioavailability of second generation is higher and more predictable. However, there is not much effect of food on both these classes of drugs. So this is all about the pharmacology of antihistamines. In the next lecture, we will discuss about serotonin.